Hi and welcome back to another video of Medic Notes. This video will be on acute suppurative arthritis. It is defined as the inflammation of a joint caused by a pyogenic microorganism, and the causative organism is usually Staphylococcus aureus. However, in children between 1 and 4 years old, Haemophilus influenzae is also an important pathogen unless they have been vaccinated against this organism. There are some predisposing factors for acute suppurative arthritis, which are people who have rheumatoid arthritis, chronic debilitating disorders, IV drug abusers, immunosuppressive drug therapies, and also people with AIDS, as they are immunocompromised. The modes of spread can be due to direct invasion through a penetrating wound or through an intra-articular injection or arthroscopy, direct spread from an adjacent bone abscess, or even blood spread from a distant site of infection. The clinical features: acute monoarthropathy is seen, usually hip joint in children and usually knee joint in adults. The features include pain of the joint, swelling as seen in this picture over here, erythema where there is reddish discoloration of the skin, warmth and tenderness surrounding the joint, and there might also be reduced range of motion due to the pain. This picture shows the pathology in acute suppurative arthritis. So in the early stage, there is acute synovitis with purulent joint effusion. And then the articular cartilage is attacked by those bacteria and cellular enzymes. So if the infection is not treated quick enough, the cartilage may face complete destruction. And then during healing process, it will lead to bony ankylosis, shown in picture D. To investigate for acute suppurative arthritis, we can do blood culture and sensitivity, joint aspiration, past microscopy and culture and sensitivity, X-ray of the joint, and the expected findings would be widened joint space, soft tissue swelling, and in later stage there might be subarticular bone destruction. Ultrasound may show joint effusion. So these are some of the complications of acute suppurative arthritis, including dislocation of the joint, epiphyseal destruction and pseudoarthrosis, growth disturbance, where there is shortening or deformity of the joint if the physis is damaged, ankylosis, if articular cartilage face erosion, and sepsis may occur in 25% of the cases if left untreated. For treatment, first priority is to aspirate the joint and then examine the fluid. Then we can start treatment without further delay. And once the blood and tissue samples have been obtained, there is no need to wait for detailed results before giving antibiotics. If the aspirate looks purulent, we have to do drainage of the joint without waiting for laboratory results. So the initial choice of the antibiotics will be based on the judgment of the most likely pathogens. Where in children we can give flucloxacillin and third generation cephalosporin. Adults, also flucloxacillin and fusidic acid, and third generation cephalosporin intravenously for 4 to 7 days and then orally for another 3 weeks. So the third generation cephalosporin is added if the initial examination shows a gram-negative organism. And after full microbiological investigations, more appropriate drugs can be replaced. So other treatment includes splintage, drainage and joint washout, and also rehabilitation by increasing the movement when the joint is no more inflamed. However, in serious cases where the cartilage has been destroyed, we have to keep the joint immobile to allow the ankylosis to occur. That's all for this video. Thank you.